If you keep looking at other people's shoulder recovery and thinking, I should be where they are by now, you're setting yourself up for frustration that has nothing to do with your actual healing and everything to do with a comparison that doesn't hold up. I'm Dr. Dan, an orthopedic surgeon specializing in shoulders. And if you've ever watched someone else get out of their sling faster or lift their arm higher, it can make you wonder if something is wrong with your recovery. I hear this more often than you might expect. Someone comes in a few weeks after surgery and says, my neighbor had this done and they were already doing this, or people online are way ahead of me. And you can almost see the shift in how they feel about their own progress. Before that comparison, they were doing okay. After it, everything feels off. Before comparison, they felt fine. After it, everything feels off. That reaction is human. It doesn't mean you're weak or doing anything wrong. It means you're trying to make sense of something uncertain using the only reference point you have, other people. The problem is that reference point is almost always misleading. Your brain wants patterns and timelines, especially early in recovery. When you see someone who looks ahead, your brain assumes that's where you should be, but that assumption is built on incomplete information. You don't see their tear, their tissue quality, or what actually happened during surgery. You don't see their rehab consistency or their difficult days. You're comparing your full experience to someone else's highlight. And in shoulder recovery, especially after 50, that's not a fair comparison. If you're early in this process and starting to feel that pressure, I do have a free resource to help you understand what actually matters during each phase. It's in the description below. Because once you anchor to your own process instead of someone else's, things begin to settle. Even when you understand that logically the feeling doesn't always go away, you might still think, they're ahead of me. That thought can show up during therapy, at home, or in daily life. Comparison starts affecting how you move, think, and respond. You might push too hard on a bad day, or pull back and lose confidence. Either way, comparison starts steering your recovery instead of your actual condition. And that's the part most people don't realize. Comparison doesn't just affect feelings, it changes behavior. So let's reset the frame. Recovery from shoulder surgery is not a race, it's a biological process. And biology doesn't care what someone else is doing. Healing depends on tissue quality, blood supply, and stress response. Two people can have the same surgery on paper and completely different recoveries. That's not a problem, that's normal. When you understand that, something important starts to shift. Instead of asking, am I as far along as they are, ask a better question. Is your shoulder responding the way it should for where you are right now? That's a much more useful question. Now, you're not chasing timelines, you're paying attention to your own signals. Frustration often spikes right after comparing yourself to others. There's a framework I use called the Shoulder Recovery Map. It helps you understand recovery as phases, not milestones to compare across people. Where you are matters more than where someone else appears to be. Recovery moves through phases, not comparisons. Even when you stop comparing timelines, there's still a deeper fear. What if I'm behind? That's the quiet question underneath all of this. So let's address it directly. Being behind is rarely about moving too slowly. It's about not respecting the phase you're in. Early on, your shoulder isn't supposed to be strong, flexible, or feel normal. Early recovery is about protection, gradual stimulation, and careful progression. If someone looks like they're doing more, it doesn't mean they're doing better. Sometimes it means they're taking on more risk than they realize, and later that can lead to setbacks. Rushing early can lead to stiffness, pain, and slower progress later. What gets shared is the impressive moment, not the full trajectory. So when you look at your recovery, focus on what actually matters. Ask yourself these instead. If those answers are yes, you're not behind. You're recovering, and that distinction is everything. Because when you stop labeling yourself as behind, the pressure starts to lift. You're not behind, you're in process. You stop pushing on the wrong days, you stop doubting real progress, and you stop feeling like you've messed something up. You haven't. You're in a process that's slower, less predictable, and more individual than most expect. That's not a flaw, it's the nature of recovery. And once you accept that, things start to stabilize. Progress becomes more consistent, steady, and less reactive over time. So if you've been stuck in comparison, take this as a reset. Your recovery is not a reflection of theirs, and theirs is not a standard you need to meet. You're not late, you're on your timeline. The goal isn't to match someone else's pace, it's to move forward in a way your shoulder can sustain. That's how you give yourself the best chance to recover well. If this helped, the next video I recommend is 5 truths about your first 6 weeks after shoulder surgery. It goes deeper into what's actually normal early on. It's linked in the description below. Thanks, family. See you next week.